Hi, I'm Jen, patient educator and director of outreach at NuCell Regenerative Health, speaking to you today on wave therapy and PRP as standalone treatments or combined for treating sexual health. Both of these treatments are effective in male and female genitalia. Wave therapy has been around for years. It's very effective in every part of the body because of the change that it has on the tissues. Wave therapy that we use is produced acoustically. We use a Storz medical device. It's FDA approved in the United States. And it can penetrate a nice depth of the tissue, unlike home units that we see for sale right now. They can only go in maybe 3 millimeters into the tissue. So that's not actually real wave therapy. We need to be able to penetrate 3-4 centimeters into the tissue, and that's what the Storz device does. It will dissolve scar tissue, realign collagen fiber, dissolve microplaque that's in the blood vessels. It will spike nitric oxide levels in the location of the treatment, and it will most importantly grow blood vessels. So the dissolving of scar tissue and all these other effects on the body are body-wide. Anywhere we use this treatment on the body, we will see those areas recover, heal, and change. But it's especially effective in genital tissue for the purpose that it does grow blood vessels. Nothing else is growing blood vessels. When we combine this treatment with injections of PRP, which is platelet-rich plasma, this is also generated from your own body. These platelets are derived from your blood and concentrated and then injected into a very specific area where they result in tremendous healing potential, especially when combined with wave therapy. It's interesting, in the past year, this has already been documented, especially in protocols coming out of Europe, that the combination of wave therapy and biologics is an accelerator. So all the protocols now, especially for dissolving scar tissue or very significant sexual dysfunctions, recommend both of these treatments. Whenever you're working with the body and regenerative medicine, we need to be flexible. This isn't medication. We're not medicating the body. We are creating an environment where the body will change. The body needs time to change, and some of us need more treatments than others. Usually 6 wave therapy treatments is the package that is started with. Sometimes patients need more. I'll just be right up front with that, especially when we're dissolving scar tissue. But these treatments work, and it's the same with PRP. Sometimes one injection is fine, and sometimes a patient needs a second injection. These treatments are very effective on women. Vulvodynia, vulvitis, any vulvular problem, these treatments will also increase lubrication, vaginal elasticity. They will dissolve scar tissue. So if you're post-childbirth, and when combined with hormones as a third layer of treatment, it's a life changer for especially pre or post-menopausal women. Incontinence. I mean, there's a lot of things a lot of conditions that these treatments will treat in both men and women very effectively. We do not have to suffer with these conditions anymore. Many men come to us with ED, erectile dysfunction, erectile dissatisfaction, or Peyronie's, and women with a whole host. So we often treat couples. What better way to make a difference in the world than to see a couple transform their personal life, and to think that these improvements are just in their sex life is small thinking. These kinds of improvements in quality of life improve every area of health. So I recommend a consult with Alan. These are or myself I also do these consults, but especially if a patient is considering PRP, I would like that to be with Alan. And also when a patient is dealing with other health impact, other diseases, other medical conditions, lots of medication. This is another area that we can help with, especially with anxiety and depression, another layer. But this video is specifically about PRP and understanding what it does, and when combined with wave therapy, and how it is beneficial to men and women.